Autophagy is not just a mechanism of cellular cleanup, it is a cornerstone of biological renewal, especially when it comes to the long-term health of stem cells. As organisms age, their regenerative capacity declines, largely due to the exhaustion or dysfunction of tissue-specific stem cells. These stem cells, responsible for maintaining the skin, blood, gut lining, brain, and more, rely heavily on autophagy to stay functional and resilient in the face of time and damage. Without adequate autophagy, stem cells accumulate oxidative stress, protein aggregates, and dysfunctional mitochondria, all of which drive them toward senescence, apoptosis, or malignant transformation. In this way, autophagy is not just helpful for longevity, it is essential for preserving the body's capacity to heal, regenerate, and defend against disease, including cancer. Throughout life, adult stem cells reside in a relatively quiescent, non-dividing state, periodically waking to replenish tissues as needed. This dormant state is metabolically demanding. It requires tight quality control mechanisms to prevent the buildup of cellular waste while avoiding excessive energy expenditure. Autophagy fulfills this role with precision. By removing damaged organelles and proteins, it prevents the activation of stress pathways that would otherwise disrupt stem cell quiescence or lead to premature activation and depletion. When autophagy is robust, stem cells maintain their self-renewal potential and are better equipped to respond to injury or stress. But as autophagy declines with age, a well-documented phenomenon, stem cells lose their resilience. In muscle, for example, satellite cells become less responsive to repair signals, contributing to sarcopenia. In the brain, neural stem cells dwindle in number and function, accelerating cognitive decline. Hematopoietic stem cells in the bone marrow begin producing more dysfunctional blood cells, raising the risk of anemia, immune suppression, and even leukemia. Across systems, the failure of autophagy translates to the failure of stem cell-driven regeneration. This breakdown doesn't only impair tissue repair, it also opens the door to cancer. Aging stem cells, burdened by oxidative DNA damage and dysfunctional mitochondria, are more prone to mutations. If autophagy fails to remove these damaged elements in time, the cell may enter a precancerous state. Worse, a stem cell with oncogenic mutations that retains some degree of self-renewal capacity can become the seed for tumor initiation. This is especially dangerous in tissues with high turnover, like the colon, breast, or skin, where dormant stem cells are periodically reactivated. When autophagy is impaired, this reactivation can become uncontrolled, bypassing growth checkpoints and launching malignancy. There is strong evidence, particularly from animal studies, that enhancing autophagy can reverse or prevent age-related stem cell decline. Interventions such as caloric restriction, fasting, or pharmacologic agents like spermidine and rapamycin have been shown to rejuvenate stem cell pools by restoring autophagic flux. In muscle, autophagy reactivation improves satellite cell responsiveness and boosts regeneration. In the brain, it preserves neurogenesis and delays neurodegenerative changes. In blood, it enhances hematopoietic function and may lower cancer risk by eliminating damaged precursors. However, here lies a cautionary paradox. While autophagy preserves normal stem cells, it can also sustain cancer stem cells, the small, therapy-resistant subpopulations within tumors that drive recurrence and metastasis. In established cancers, autophagy may help these malignant stem-like cells survive chemotherapy, evade immune attack, and continue propagating the tumor. This duality demands caution in clinical applications. Enhancing autophagy across the board could support regeneration in healthy tissues while inadvertently stabilizing malignant clones in patients with undetected cancers. Therefore, timing and specificity are critical. Anti-aging therapies that boost autophagy may be most effective when administered before stem cells have accumulated severe damage or transformed into cancerous forms. Tissue-specific delivery systems, intermittent dosing, or biomarkers that identify individuals with intact autophagy signaling may help target these interventions more safely. Alternatively, combination therapies that simultaneously inhibit autophagy in tumors while enhancing it in healthy stem cells could one day offer a more balanced solution. In sum, autophagy is vital for stem cell maintenance and, by extension, for preserving the body's natural ability to regenerate and protect itself from age-related diseases. Its decline with age is a central driver of tissue degeneration, immune dysfunction, and cancer vulnerability. Supporting autophagy in stem cells offers a powerful strategy for extending health span, one that must be implemented with precision to avoid feeding the very diseases we aim to prevent. As the science of regenerative medicine and autophagy biology continues to evolve, this balance between repair and risk, rejuvenation and restraint, will determine how far we can go in reversing the cellular damage of aging.